topic no and yes your friend no uveitis. Na ebehwe ede ade na uveitis eye condition eye disease nti yebehwe types of uveitis. Na types biara no any the risk factor me can risk factor conditioner and niema betimi a promote sa uveitis na that type no yebehwe symptoms eden sunsu and then signs no behu say onipa no owo uveitis because uveitis eni yare a wanhwe ni ya etimi ma ema wanifra etimi ma glaucoma etimi ma even cataracts etimi ma retinal detachment retina no that is a number one wani nechi no etimi move the position na move the position na sabi etimi di eni efra ediba na ebehwe causes de bankasa na yahwe ehun sunsuanso complications of uveitis. Nti ma join me a medamase pa US for Canada for medamase UK for Europe and a few people are who also in Ghana medamase pa say ma join me our platform so many so yena ye bie ni a topic so na yenhwe uveitis no ye ka say uveitis in fact yare bia the last 4 letters no itis ebia no inflammation and into example you war hepatitis it means inflammation of the liver. Now you can say arthritis it means inflammation of the joints. Into it is bia na therefore inflammatory disease. Now you shema inflammation as a fertilizer and that is the foundation of all diseases. You shema. Now uveitis no a general word medically no omo use a describe group of diseases in yada wa affect weni ema weni etimi ye kokko ana yaw etimi eba weni mu na weni so etimi ye inflame it means etimi ho nti eno no ene fe no uveitis this group of diseases etimi ma weni ye kokko ana yaw etimi ba weni ana weni etimi den swollen ana ho na yehwema uveitis ene yare affect all age groups nkola mpanifo young teenagers but yehwema emma pa in between 40 and 60 no affect you pa. But all other groups also no affect you. Now uveitis here and yarea so one treating one reversing it may lead to blindness and that lead to vision loss. In fact gradually no ubonse nipa no lose the vision. Obi beka say doctor she said the okasa wa any yarea ho pa o nan saying yes because any yarea doso. Now fortunately no so no you any yari dra both internal and external ya to ni din clear eye no obia betimi anya bi prevent any yari bia but yen koso na yehwa say ye betimi at uveitis asia na say ye ti ade afa ni uvea e ka say uvea den uvea sometimes afa no uvea layer the middle layer of the tissue of the eye. Say ye nino ye nama layers. Just a twatwaso. Ye nino your 3 main layers. Now the middle one no, and if any uvea no. Now no affected and no if any uveitis no. Now ye share uvea and no it consists of iris uvea na consists of iris show ahwehwema iris no a colorful part of the eye nti wani blue no na iris no wani before you most brown nti ho eno na say na ye iris no in the middle of the iris no and your pupil no eno no yetokura light no efem so wo hwa ade efem na akoto lens so na ene color bibia na akoto retina ne ye nama wo wani nachi na sa information akọ brain mu na brain no a process sa information no answer na wahu ade a wo hwe nti iris no so important but a part of the uvea no And you one another part of uvea na efeno choroid. Choroid no ena ebua ye lens na we ye nino a focus to focus. Send ye bitimi ehu ade. Ye fra another part bia no so ye part of the uvea no. Efeno ciliary body. Na ciliary body no ena e contain blood vessels announce intima moja fem na eno no e provide ye nino aduane ma hoden eni moja with oxygen. Inti sa celery no so no ene connect part of the eye white uhwe wani a wani white part na fe sclera na eno na connect eno na connect afen so no wo retina. That is a number wo wani na chi no who say pasa e affecting no, that's the uvea no it may ma nipa go blind. Inti ye tiasia inti se sa layer no I won't fin ye nin fin and nam no say ye inflame and they are affected now any offend uveitis no. Inti I hope say ya tiasia adia offend uveitis no ana yadia offend uveitis ne yadia e affect the middle layer of your eyes na aye swollen. Now the character no say we need to me red na e yaw to me ben ye pass symptoms a ye betime chire mo. Now then your types of uveitis. Now make a candy kese beyond me ye simple cra. The first type of type bia ene dear a bit me at the aba. Now you're sure the first type na most common piefen anterior uveitis. Of course because when your anterior uveitis are the most common type of uveitis. There's in the normally affected the front part of the eye. Na no normally obi our arthritis your friend no ankylosing spondylitis AS a immune system disorder to me affect o spine and o lower back no na ma o spine is stiff why is stiff a friend ankylosing spondylitis so be wa etimi the uveitis etimi the ba. Obi nso our gastrointestinal disorders, this is IBS. It means irritable bowel syndrome. Irritable bowel syndrome no digestive problem and obi didia na afane yam na chese or cold toilet why ni yam na is sensitive. Aduane bi ebeto ne yam bia na or wenya diarrhea. And if any IBS, irritable bowel syndrome. Into obi was ayari and as a gastrointestinal disorders sana it made the uveitis it made the ba and then a tray say ye yam niamano anye jume ya itiminya and the yadie in the yadie onwo a risk for that and the yadie and into your large bowels no your FN column no say if you ho and no boa or constipation in fact sabi stool ni bo ha sabi tifi ni bo ha timi ko ka ho 6 months na e wo ho and so no bi nipa no sabi otimi gya ne nan yo and so the particular stool bi wo ha empie nti e ba pra obon se kire ne wanya ene yade ana say wanya more serious problem of the colon or the large bowels and nti e wo ma say e colon cleansing now cleansing o colon no e detoxify ho. Now make sure say won't constipate because your digestive system no etimi and yare etimi ediba which can lead to blindness. Intenya diabetes unko and cause glaucoma ne cataracts ne yare. O gastro system no so ne adwuma etimi and yare and so etimi de ba. Hope say yetiase. You another type your friend no intermediate uveitis. No affect young adults pa. No say young adult no multiple sclerosis MS and no a multiple sclerosis no a quite serious health condition a affect nerves no is electrical wires electrical wires you where unsaka electricity nkiku because I covered sa na nerves nso tie cover wo ho na cover no your friend no nerve fibers and now myelin sheath. Na in multiple sclerosis, no bones sa myelin sheath cover na why sa I tell you about multiple sclerosis it minya and yari vision problems and now muscle weakness, loss of balance, ultimate balance on your numbness, multiple sclerosis yarebɔne obi wa osan etimi nya uveitis nya risk factor ni bia obi nso ewo sarcoidosis no nso no immune system disorder normally no affect organs bia but especially your harawa your lungs and your lymph glands no itimi affecting pa na eno nso wo ho obi nya sarcoidosis make can say affecting lungs, even kidneys, affecting heart as well. Otimi nso nya uveitis, etimi de uveitis, etimi edeba. I hope say yet say another type of uveitis, if any posterior, no enye common too much, but also so etimi in fact affected retina, parts of the eye, and optic nerves, and a corridina mekan was part of the uvea no. Now affecting no, na edi any fryer about last part no no pando uveitis no enye common kra but say a bar etima ma onipa no permanently onya permanent vision loss na normally no sa problem viruses any bacteria etime de ba syphilis ni a bacterial infection sexually no affecting nipa se nipa na treated syphilis ni ya etimi ede uveitis a serious one yi etimi de ba nti wo ho ye be ma yo ba e ma de omunya syphilis kra omunhu je oba ma de ne ho aka no na afi oba ma na se bi nsuo efi se be ne be ma na emu hihye no syphilis na emu je se nsuo fi mu ba syphilis e bone because etimi ma nipa in fact affect nipa brain but etimi de uveitis nso de ba sarcoidosis na meka wasem no eno so timi this type of uveitis etimi de ba tuberculosis nso a eno so TB no etimi de uveitis etimi de ba this type of uveitis no that is a panouveitis etimi de ba this is yehu types of uveitis no ene ade etimi de ba for this type C but ye beba symptoms no so ebe de na wahu se o uveitis ekra the uveitis here can one same a who nsenchene ben obehu before amade symptoms better so no memfa number ento so ofre outside the UK a year na menso e WhatsApp but my WhatsApp in betimi me akasa wo normal phones so a year +44 738 464 7300 ofre within the UK so a year 0738 464 7300 number share for mobi na obi anu achire na unse on here amwa na me be shira for that now anyo obi kra no nim na ye wo na ofere so ye fit cry nipa the ofere so ye fit no na bibia start because symptoms na e bia kan wasem no wo symptoms no na che say yare no edu achire wi o the 5th level out of 6 of disease development it na edu achire wi first 4 no dey show symptoms bio of disease development only the 5th no it is all na unya symptoms bia no nche say wo ahoden eno no nchire sa obeye fit sadan so hwehwe ni paduanim na bo ho ban obiara so bo ho ban as ye hu say na Bible can see you things in advance. Now we hide ourselves from the danger. Very important. The young call a so to say symptoms and also. Anyway, so here any yari drew, especially eye drop. I will be a friend. Clear eye dropper. Frame. San number na mediato sono. But my tongue will be I born when you feel sure when you dry, inflammation, when you red, any problem be when you cataracts preventing would be gusso. Be any ho crowns of a gusso, now preventing. In yada why bit me about when in so. Symptoms in a day, symptoms on a normally no a bit about gradual, and I say in perfume sudden naba. Now first symptom no bones when near I we see blurry vision. Now when who floaters vision no na I said dark floating shapes dark floating shapes after no bones yaw when ni nankasemu because pressure abem pressure no to echo etimi ko high. It means that uveitis no it may lead to glaucoma. Obo obefele say diabetes nkwa na di glaucoma eba. There be uveitis etimi di glaucoma and nso so etimi de ba. Na sani pa no bones na ni aye sensitive ontimi hwe light and ontimi hwe wia. Bones wa dark glasses. Ewiem aye sum kra na wa dark glasses because na ni aye very sensitive. Ye fe no photophobia. Te wo photophobia it means say when ni nya adwuma yi tissues no ho aka. Red eyes when you kokko na afi bones say when you cloudy o hwade hu ni ye na wutinzu yo ya. Finally no onipa no betime lose the vision. I know see a symptom no but is a final loss of vision. It may can be symptoms no a blurry vision. Na so hu ade e papa na when so no what floating shapes, dark shapes. Na when ni na ya wom ana pressure to me build it up won be kwai because when you glaucoma na amount drop na ye amount drops fe guso drops in fe guso on ye glaucoma no ho hwe na yare ankasa no because glaucoma cry a symptom. Pressure in the eye is a symptom of underlying eye problem. Na headaches wo ho when na ekoko sina meka no unya photophobia, light sensitivity na no so ho. Nti eden na de ba ye hwema de ba pa no viruses and bacteria and immune disorders. In fact, immune disorder, immune system na nya dwuma ya viruses no any bacteria no omutindim de yare bebre eba ni peduenem ebi any uveitis. And it's very important say your immune system is strong. You're maintaining no, and you're only for viruses and bacteria, but it's also for other diseases in the body. Into your shuma, a clear party where you were different bacteria and virus infection like syphilis, sanamaka seminal, ninara, etimidiba, tuberculosis, ninara sono, etimidi uveitis, etimidiba. And I can say autoimmune disorders and inflammatory disorders, ede uveitis in eba. Examples on the be psoriasis. Psoriasis or bones a autoimmune condition now. About the cells and the body cells are rapidly produce more bones and the skin. There's overgrowth of cells. Now the skin scaly. Now a hormone hene a psoriasis. Now I pepe a ointment astra so no a immune system inside. Obo or rheumatoid arthritis. A immune system disorder ubia ubetimi so ebetimi the uveitis ediaba. Crohn's disease a serious condition autoimmune inflammatory can affect anywhere from the mouth to the anus. Your gastric system no your GI and yejuma inflamed by affecting no and ankylosing spondylitis. This form of autoimmune disease so no that is arthritis no and also so etimi ediba. Multiple sclerosis MS and also etimi ediba and unya injury to the eye. There's a trauma to the eye and that's where we're supposed to when need to chemicals acha and also so it make a day uveitis and so it me ediba. Ti hu niema different ways channels uveitis etimi ediba. Insunsan so ben ena uveitis betimi diaba. First insunsan so no retinal swelling. Wenina enamna wo wenina chi no no retina no. Ubensa ho I tell you if retina no information entimin ko brain nim ye and entimin o brain interpreting ye into one hwea na de sani pa na de anifrai ene edeba. Retinal scarring. Retina the same retina no bones etwa. And also see betimi de aba. It means uveitis etimi cause blindness actually. Glaucoma uveitis sanameka no etimi ma o pressure o when increased into diabetes only diabetes cra now utimi unya uveitis betimi nya glaucoma so shannon so cataracts it any one of the complications of uveitis and optic nerve damage. You can say optic nerve damage now. Wire na anase nerves na connect retina na woni ankasa to your brain no it be damage uveitis it me damage no enti ye hwema atiefo uveitis ni yade ya yenim say affect the third layer and no when the middle and namna what inside no of your eye the middle part which consists of the iris, I can't watch seminal, celery body, so on, and no, affecting no. Now a mouse symptoms say when niankasano, a young womb, and nina red, when in the swellings, now things, we have why you're sensitive to light. That is photophobia. Why you're sensitive to light. Now things finally no unipano any betimi efra. Uveitis say yare bonny. A tearful may ni who grow. So when you're yare bia and do one grow. And you find drops keke in gugu weni. You were in rubber fako inside. Na ako unipeduen ma komujam. Na abuao. Na ode external applications so aka ho. Madam Asipa say mo joining for this topic Uveitis-Eye. You be call English version so. After this commercial break, when need J English version of this topic now Uveitis now, then stick around. Thank you very much for joining me. I visited me our YouTube channel no for Dr. James Natural Link. Dr. James Natural Link. Now subscribe. Share a lot of beautiful information short programs in the very close future. New programs by no live I met in the beto video so subscribe. Now press the like button, then like us. Now support to Jumedie. Young commercial break. Now thank you very, very, very much for joining me today. I appreciate your companionship. So I make kind of say if you're interested in the English version now, let's go for this commercial break and then join me for that English version. Yami Inshramupa. Next week and also no with the brand new fresh topic and so on.
I am the God that healeth thee. I am the Lord your healer. I sent my word and healed your disease. I am the Lord your healer.
The first development of diseases is in the cell's tissues before they get into the blood, urine, and stool. Diseases do not start in the blood, so if you are waiting for the test of your blood cultures, the results will be only a confirmation of a well-developed diseases. Remember, had I known is always at last, hence why I'm recommending Dr. James Natural Link sector for you. We have latest smart machines which is used for diagnostic assessment to determine the condition, the root cause of your condition, and even what is about to occur in the body from 6 months to 1 year. Dr. James is an experienced natural medical practitioner, gerontologist, and health educator. He graduated from a renowned Canadian institution and practiced in Europe. We offer many natural therapies like detox, pain management, skin problems, weight loss, anti-aging, and more. We give advice on dieting for all medical conditions. With over 20 years of experience, Natural Link can naturally help you support your body cure itself of diseases such as blood pressure, diabetes, arthritis, stroke, kidney and liver diseases, prostate enlargement, asthma, allergies, hair loss,